Well, I am super excited to have Timmy here telling us about your story. I appreciate you offering your time to give a testimonial. When you originally came in, just tell us, what were you feeling? What was the reason you picked up a phone or emailed us, Timmy?
I was at the point where it was surgery or something had to be done. It was to the point where I was having trouble walking or doing any physical activity. The weight wasn't helping, but most of it was the knees and my lower back.
Knees, lower back, left knee, right knee. So you somehow saw an ad, you picked up the phone, you said, I got to try this place. Tell me about the knee pain, left side and right side. What did it feel like? How did it prevent you from doing some of the things, and what were some of those things?
So it's so much pain, I couldn't do very much walking. A lot of family activities just was out of the question because it was physical things. I have a lot of grandkids. Couldn't participate in that, so I would just pull myself out and let them go do their thing, but not now.
Wow. You're 53 years old. You were, do you mind sharing your story? Because you have a heck of a story with your weight loss. You had done a lot of work yourself. How far out how much did you weigh when you, like, at your biggest?
So at my biggest, I was like 355.
355.
Yes.
And you lost how much weight before coming into the program?
Oh, a good 60, 70 pounds. Anyway.
60, 70. I think
Might have been more than that.
It had to be more than that. You weren't. How much did you weigh when you first came in? Was it like two?
To tell you the truth, I don't even remember. Yeah. It's part of the past, but I was.
I'll tell you what. We'll work backwards. You are now around 205.
Yes.
Is that right? And you said you lost around 40 to 45 pounds in the last 3 months.
Yes.
Going through our program.
Mm-hmm.
So you're now down just above 200. Dumb question. How are you feeling? What's going on with the knees and the back and just your general sense of well-being?
So, of course, all the weight loss is great. Energy to spare, knees, no pain, even jogging. I can do some light jogging and I have no pain in my knees. Back doesn't bother me anymore. No stiffness. And I can do anything I set my mind to. Everything that I've tried so far that I wouldn't have thought about before, I've done and accomplished with no resistance whatsoever.
Let's be honest, and maybe I don't know the answer to this. Of the things that we had you do in the program, the at-home equipment, the diet, the supplements, coming in here, having Joshua drilling on your knees, of all that, which was the most difficult or challenging for you?
None. For me, none. The situation that I was in, that was a cakewalk considering what I was headed to. So none of it I didn't mind. All of it was explained well.
Good.
Easy to do. You just have to get it in your mind and do it.
Excellent. You said it was a cakewalk. Is that a keto cakewalk?
Yes, absolutely keto. Everything is keto.
You said, and I don't know if that was just through this program, but you said you were on multiple medications. Do you care to share with us?
Yeah, I mean, at times, actually, I had gout. I would have to be careful what I eat, and took 3 blood pressure medicines. Every time I turned around, it was something. When I went back, I was eating ibuprofen left and right for the pain.
Wow.
All that's gone. I don't take any ibuprofen. The only thing I take is the supplements and some over-the-counter vitamins.
Yeah. You're taking no medications.
None.
You dropped 3 blood pressure medications, the gout medication, the ibuprofen, which of course is tearing apart your kidneys and your liver.
Yep.
So you're just done.
Yep.
Somebody who's watching this program right now is looking at you and they're thinking, they're skeptical. They're wondering, I don't know if I could do it. This guy was 355 pounds. He got all the way down to 205. What would you say to the skeptic, somebody watching this right now?
You have to at least try. You have to. If you can get it in your head, you're going to do nothing but great things. And that's all I come in with the right mindset, and the program works excellent, and it's easy. Just do it. You have to at least try. I've had back surgery. I've had leg surgery. Anytime you can get out of surgery and it works, you have to do it.
As we were just talking about, it's the road less traveled, the one that you've decided to do. I mean, let's be honest, it's easy to take medications for blood pressure. You throw some pills down, drink some water, you're done. It takes you, a couple minutes.
Yep.
But it's the road less traveled, the higher road, if you will, the tougher road is to do what you've done. And that is make different choices about your food, actually get up, work out. How many days a week are you working out now?
I try to do a little something every day.
Okay.
Sometimes Sundays, if we're not working, then I'll take a little break on Sunday. But I always try to do something.
Yeah.
Even if it's not without weights or if it's just take a walk or whatever, I do something every day.
That sounds doable. It's
Yeah,
not like you're
it is.
Arnold. You're not spending like 4 hours
No.
a day, 2 workouts a day. You're just focusing on your diet, which is watching those carbs and the sugar. You're focusing on that, which I've read is 70% of all of your weight loss.
I believe that.
So you're focusing really tight on the diet, and what you said is you're making your very best attempt to do something every day, whether it's in the gym or not even in the gym. You're like, maybe I just go for a walk around the block.
Yep.
Sounds doable.
You have to, and I travel for work, so this hasn't been not the easiest thing to do, but it's doable. If I can do it, anybody can do it. Because I was very unmotivated to begin with, but since I started losing the weight and got in this program, it's been nothing but motivation because it's been positive. You just have to do the work. It's not hard to do, but you have to do the work.
Not hard to do. Nothing's hard to do, but you have to decide to do it and then do it.
That's the key.
Enough said. Thank you so much.
You're very welcome.
Great job,
I
brother.
appreciate everything.